Good afternoon. I'm Dr. Stephen Henson, Medical Director of the Emergency Room at Galicia Heart Hospital in Wichita, Kansas. Happy New Year. And with this time of year, one of the most common things that we are currently seeing in the emergency department is what is referred to as acute gastroenteritis. Sometimes people refer to that as, quote, the stomach flu. This is typically caused by a virus that attacks the gastrointestinal tract and either causes violent vomiting and or diarrhea. Why does this particular malady occur during the winter months? Well, as you know, we spend more time inside during the winter months because it's cooler, and then with the holiday season, a lot of people hugging and kissing and meeting relatives, so you get to bring disease from a number of different states and bring them into a collective area. And with holiday greetings and interaction of family members, it's easily passed as it's highly contagious within about a 12 to 24 hour period following exposure. And then of course at Christmas parties, I've got this piece of baklava, here, I'll take a bite and you try it. So it's easily transmissible by the oral route. The important things to know is that if the virus attacks your upper GI tract, you get intractable nausea and vomiting. And if it gets to your lower GI tract, that you can get pretty much confluent diarrhea, which can make you profoundly dehydrated. Now, what can you do at home initially if you start to feel symptoms of acute gastroenteritis or stomach flu? You could start on clear liquid diets if you start to feel any pressure in your stomach, because the way the stomach operates, it has a trap door from the esophagus that is only supposed to open one way, and the intense acidity of the gastric acid, if you build up enough pressure, it has to build up enough pressure to flip that valve open, which causes a tremendous amount of distress in the epigastrium, or the center of your stomach. When that flips the other way, you get that acidic taste in your esophagus, and that's why it's no fun to vomit, because it's a tremendous amount of force and then acidic taste. What can you do though? If you start to feel pressure in your stomach, you can go on immediately on a clear liquid diet. There's some over-the-counter products such as Imitrol and Pepto-Bismol that can alleviate some of the gas buildup. If you get diarrhea, certainly you can take Imodium AD, or one of the great home remedies is you can use the spice nutmeg that you use to make pumpkin pie with, and a teaspoon of nutmeg in a glass of water will nearly stop diarrhea in as little as a half hour. The important things to know that if your vomiting and diarrhea doesn't stop within about 24 hours, or you've begun to pass out, that you need to seek medical care. Vomiting intractably is the initial presentation for a new onset diabetic, and they can get profoundly behind in fluids and get in real trouble. And then the extremes of age, from small children to our older people, our parents and grandparents, they can get in trouble with dehydration, particularly the older population if they're already on diuretic medications such as Lasix or Bumax, and if they're already on blood pressure medications which would lower their blood pressure, such as metoprolol. So the important thing is try to avoid exposure, and you can do that with good hand washing every time you interact with somebody, from handshaking at church or at a party, washing your hands every time you clean up dishes, not sharing the same drink at a party, and trying to limit your exposure to multiple patients. And if there's one thing I would recommend, if you're sick, don't go out and infect other people. Don't go to a party if you're feeling sick. Don't go to an engagement that you're supposed to be at if you're feeling sick. With that, I hope you have a healthy and safe winter months here in Wichita, Kansas. Thank you.